Good afternoon on an August day, which feels a bit more like autumn these days. Welcome to the Galen Growth Cohort Summit 2021, which is Galen Growth's annual social responsibility program dedicated to scaling digital health ventures. Through this program, startups engage with Galen Growth's unmatched network of corporate and investor decision makers to increase your visibility in the digital health community and build relationships to reach our common goal of solving the pain points in the patient journey. We grow the ecosystem together. It's a unique program with no fees, no equity taken, as we collaborate together to push innovation further. Today, I'm joined with two very promising digital health ventures, all members of our program. My panelists today are from Predictiv, Sajung Yun, who is the CEO, and from Yesmom, Peter Macquart-Moulin, who is the CEO and founder of that venture. I am Julian Salaberry, your moderator for today, the CEO and the co-founder of Galen Growth. And Galen Growth is the #1 digital health private market data and analytics provider to industry and to investors. Let me deep dive a little bit for you to give you context. Predictiv describes itself as a personal genomic solution for predictive medicine. It identifies the genetic predispositions of an individual on over 22,000 diseases, enabling the physician to take preventive actions and treatments. It was founded in 2020 in the USA. It is a B2B2P platform. It is categorized as a genomics-related diagnosis type business, pre-Series A, and we give it an alpha score, which is our assessment of maturity of 45. Now, it sounds as if it's in the bottom half, but it isn't. 45 purely reflects the fact that this is a new business, it's a young business that's growing, and it's got a lot of room to grow. So it's actually a very good score for a new business. Yesmom describes itself as making accurate health information more accessible via at-home hormonal testing kits, empowering its customers to make more informed decisions about their health. Their key stats was founded in 2017 in Thailand. It's a B2C model, as you will understand through the conversation with Peter later on. Again, we would rank it in the genomics-related diagnosis category. It is again a pre-Series A business, which means its alpha score is 49.5. So as you see, roughly the same ballpark figure for these two ventures, deliberately picked for their maturity and their focus. So what is our panel discussion today? Well, it's entitled, When a Small Sample Helps to Discover Breakthroughs. More specifically, our synopsis really is trying to drive a debate around how minimally or non-invasive diagnostic tools and therapeutic procedures are marking one of the latest innovations in healthcare, and all of this driven by digital health. These solutions promise not only to support the diagnosis and the treatment of patients, but also enable healthcare providers to perform early diagnosis and ultimately prevent diseases. So in this panel, we are aiming to learn how these innovations can result in more convenient, effective, and less expensive treatments, as well as helping to empower the healthcare of consumers. So let's start. Let me start with Peter, if I may. So Peter, why is this different? Why are we actually looking at a new type of technology, and why is it making a difference at diagnosis level from what we're usually used to?
Yeah, well, from our perspective, we haven't necessarily created new tests. We haven't created new technology in that sense, but what we're doing is leveraging technology to improve access. So in a way that I think laboratory diagnostics, biomarker testing and tracking is critical to identifying disease early and treating disease early. And what we're doing with microsampling is making sure that the healthcare consumer has access to these sorts of tools much sooner than the otherwise would have. That means that for a lot of our consumers or a lot of our customers, rather than being kind of frozen out of some of these clinical tests, diagnostic tests, because they didn't meet certain criteria or it was an issue of affordability or convenience, they're able to be much more proactive about their health and identify issues before they become a problem. And so for us, that this microsampling technology and the digital tools that help to decode the results in a way that laymen can understand the significance for themselves means that we have a much more empowered consumer, and they can continue to have a regular conversation with their doctor, but they can go straight into talking about mitigation, talking about if it's necessary, or treatment such as lifestyle adjustments or medication, rather than just trying to decipher what these means. So for us, it really is a question of access.
We'll come back to access. I think that's probably a key word in healthcare these days, particularly in context of this particular type of technology. Sajung, you're coming at it from a different direction with your business in terms of how you are helping the process of diagnosis. Why is digital health and the technologies that are coming about through digital enabling you and your business to be able to provide the solution that you do provide?
That's a great question. Let's think about the typical standard of care. Physician goes through the workup with the patient. Patient complains of certain symptoms, and physician think that during the differential diagnosis process, okay, this most dangerous things I need to check is this, and then most likely things, most popular things are this, and then from the process of elimination, and they ordered a couple of tests to see if their guesses were right, and then confirm it. So typical standard of care was to order the test one by one. For example, if you suspect cystic fibrosis, then you order the cystic fibrosis genetic panel to do it. But as everybody knows, next generation sequencing came out, and then instead of the single sequencing, you do one by one, or microarray, you do about 1.4 million cases. You can do entire 3 billion the nucleotide sequencing, and by within 60 hours. So that means that now digital healthcare especially for precision medicine, you have a tool, you have the option to provide entire genomic surveillance is possible. So what we are doing is that we get the digital file from the sequencing, and then we analyze entire 20,000 genes for cross-referencing to 22,000 diseases. So that's the power of the new generation of the digital healthcare. Yeah.
Exciting. I think you mentioned the term digital twin. I've heard, and a lot of us are seeing that term increasingly appearing in media and articles, etc. For the benefit of everybody who will be watching this during the Cohort Summit, can you define what a digital twin is and what it is not?
Yes, I like to define digital twin first, and then I want to mention digital thread and then digital neural network. So at first, digital twin is just copy of yourself, digital copy. And currently, people think of the avatar. Like for example, Facebook, you put avatar. That's the beginning part of the digital twin. It mimics what you are looking, but we need the data incorporated to that avatar. So what is the most unique thing for the human being? That's DNA. Everybody's DNA, even identical twins known to have the different DNA, about 5 to 10 nucleotide. So digital twin is very unique for each person. So that's why we are starting the digital copy of yourself, digital identity of yourself with entire genomic information incorporated. So that's the digital twin. And then let me tell you a little bit more. So how are we gonna use simulation? For example, you wanna simulate your digital copy of yourself before taking any drug. So we provide 750 drug simulation. So a lot of gene to drug interaction is known. For example, if you take the tamoxifen and certain genetic mutation, it's expected to have a side effect, but you are still getting that drug because physicians don't know what your genotype is. But so when you simulate giving the drug to yourself through the digital twin, you can prevent those known errors. There are a lot of errors you can prevent. So that's the use is a digital simulation by digital twins. And then digital thread is that the digital twin has a certain mechanism of action. For example, digital twin is often used for the car to maximize its lifespan for the engine, and all these engine or the wheel, all these things. So for the human health too, there are certain sequences, predetermined sequence, for example, DNA to RNA, RNA to protein transcription and translation, etc. So that's the digital thread. And then, so when you have a mechanism of action, then there are a lot of things between cytokines, between hormones, all these things interacting. So that's the next step, which is digital neural network of the digital thread. So that's what we are aiming to, we are heading to.
Fantastic. And very helpful definitions. So who's your customer then, Sajung?
Our customers are the people who like to use the genomic information to prevent future significant diseases.
So is that a healthcare professional or is that the patient?
They are the patient, but it's delivered through the healthcare professionals because some expertise are needed. Yeah.
Of course. Okay. I'll come back to that in a minute, Sajung, if I may. So, Peter, your model is different, though, isn't it? I mean, I think you deliberately describe yourself as more the consumer side. So that's the hard bit, though. Again, the consumer to see you as definitely an option they should be taking ownership for. It's hard in its current circumstances. So how are you achieving that?
So two ways. I mean, we have the direct-to-consumer model. We look at very specific use cases to offer packages, test packages. So that's why fertility was the first one, where there is a very specific need for a consumer to want to know more about their reproductive health in a timely manner. The other we started to look at is polycystic ovarian syndrome. So it's more symptomatic driven, but again, still within the fertility space because consumers, they're thinking about getting pregnant. Polycystic ovary syndrome affects 1 in 5 women and is often underdiagnosed and is the cause for about 40% of female infertility. So we look at very specific use cases. We're also launching heart health tests, diabetes tests, which are predictive models. So if someone is, for example, has a high AMH, high testosterone, it's an indication of polycystic ovary syndrome. And our predictive models suggest that that person would most likely also have prediabetes, diabetes, inflammation markers, or kind of elevated cholesterol. So we can start to look at other tests based on our predictive models. So that's one, and there's other tests like food sensitivity that are just high on the consumer's mind, and they seek out. The other model is that we're working with telemedicine providers, and this I think is really interesting because there is a bit of a gap in the telemedicine space beyond what I think is just acute care, and being able to have doctors, telehealth providers prescribe a wide range of tests, so that at the end of the day, you don't have the consultation at home only to be led to have to go down to the clinic, hospital to take a blood sample, and that those biomarker tests are still critical to diagnosing disease. And the other is actually we're also providing these kits to some smaller clinics that don't necessarily have the same in-house lab infrastructure, and providing kind of lower costs for them to be able to use these sorts of tests. The dry blood sampling really does help reduce some of their costs, and it's just as reliable as any venous blood draw.
So sorry, go for it, Sajung.
Yeah, I think I just want to point out about the small blood sample because today's topic is about the small sample and digital health. So Peter just mentioned the dry blood sampling, which is you basically poke the fingers and then put it into the paper, and so very small blood sample, which is very convenient and accessible to the people. Which is a typical trend of the digital healthcare in the industry. And also, let me elaborate for our company. For the entire genomic sequencing, you might think that we need a lot of blood. The answer is no. For the blood, we only need 1.5 milliliter of blood. So we can just use the typical blood drawn and then we only use a very small portion of it. And then for the digital healthcare, so we are also having another process we put a lot of emphasis, which is the fingernail clippings. People clip their fingernails every other week or so. And then what we are doing is we collect those from the people. We only need actually one, but we usually ask for the 3 to 5 just in case. So when you just take the fingernails and then we get it, and our kit is basically new fingernail clipper and a collection jar. That's it. And then when they send it, we just melt it. Fingernail, as you know, is mostly made of the keratin, and then keratin has a disulfide bond. So based on when we are using the specific chemical to get rid of disulfide bond, we can extract the DNA from it, and then we sequence the DNA. So it's a very accessible to the customers. So small sample and accessible samples are the hallmarks of the digital health for this year 2020-21. Yeah.
That must have been the first time I've heard the term fingernail appear in any of these conversations. Very novel. I'm intrigued. Peter, when does the healthcare professional get involved then in, I guess, essentially that particular insight derived from your product in the hands of a consumer?
Yeah, so there's 2 ways. I mean, one, it's if it's being essentially prescribed by the telehealth provider, they're the ones doing that initial consultation, ordering the tests. The consumer then takes the test. It's with a finger prick. We only need about between 20 and 80 microliters of blood, so it's really just 2 to 3 drops of blood. We then provide a layer of interpretation. So again, so that the consumer is not just looking at the results. And one of the questions we get a lot is, well, if my results are normal, I still want to know what that means. I still want to know what normal means, and particularly if there's something that is outside of normal ranges, what is that? What are the implications for my health? So then they can go back and have a follow-up consultation. But at this point, they're not just asking, what does it mean? They can really deep dive into these issues. So if I have PCOS, if I have low ovarian reserve, what are the implications for me wanting to start a family? Or, now we flagged issues that I might have prediabetes and heart health issues. What actions do I need to take next? And really, it's similar if we're doing a direct to consumer. They can buy it either directly on our website or through other kind of healthcare marketplaces, and we give them the option of having a follow-up consultation. But usually, it's a very short because unless we're looking at kind of follow-on, so particularly with food sensitivity and other issues, or if we're looking at lifestyle adjustments. Then there is a plan on how to kind of mitigate that. And a lot of the hormonal imbalances can be mitigated just with lifestyle changes. We've had users retest in 6 months that had been flagged for PCOS, and through diet and exercise, and that doesn't work for everyone. I'm not saying you can cure PCOS with that, but for a lot of people that actually helps, and their hormonal imbalances were back to normal, and that's through a healthcare provider. Being able to coach them and create a plan to mitigate these things.
It's fascinating because we could go on for some time and run out of time exploring further, how the technology works and how it's received. One of the things that for me fascinates me about small sample, to use that term to describe today's discussion point, is almost the role it's playing in democratizing healthcare. And by that, I'm really looking at the standard 3A's, the awareness, the access, and the affordability of healthcare brought about by this type of technology. I think we've started to touch on the access side and the fact that there is going to be easier for HCPs and or patients, consumers, to be able to take ownership and to be able to access information that normally would be extraordinarily expensive or certainly too many hoops and hurdles to get to. Affordability, though, help me understand, both of you, and let's start with Sajung quickly, but help me understand how you're affecting affordability in a positive way, and therefore contributing to democratization.
Yeah, there in the world of bioinformatics, there is a saying called genomic sequencing $1,000, but genomic analysis $100,000. So it's because sequencing is the mechanical process, and Illumina and or other companies drop the sequencing price. PacBio, all these companies. So sequencing price went down significantly, but analytics, digital healthcare of this space is not fully developed as them compared to those sequencing itself. So what we are doing is that we were democratizing. So we actually provide the entire genome sequencing as well as the analysis at $800. So
wow.
In this case, we are using the whole exome, which is the only protein coded part, but the whole genome part will be able to do it probably around $1,500. So, but as you know, for example, Zellweger syndrome, if you test that in the United States, that test alone is $3,000. Cystic fibrosis test, probably a couple of $1,000. But when you combine it, it's astronomical cost. But here we can do it with $800. You can test all. So yeah, so we made it pretty affordable.
Yeah. It certainly helped to drive the cost down. I was amused by the $1,000 for sequencing. It just simply ignores the $3 million it costs to buy the Illumina machine, which doesn't seem to be counted in the total cost. But there you go. Peter, what's your angle then in terms of improving affordability?
Yeah, so I think affordability is one of the probably the second reason or value add that we have in terms of enabling access. So one, it's obviously we're removing dry blood sampling, removes the need for a phlebotomist, removes the need for for cold chain storage to a lab. It's already that in a lot of other kind of clinical costs you would have, and our samples use standard workflows for the lab. So actually, the cost in the lab is the same or even lower, particularly with new technologies. Some of our samples use LCMS, which is really remarkable. So and we're able to centralize samples to a lab. So a lab typically would service a very specific geographic area where the logistics make it cost effective. Now we can actually, through a couple labs, centralize samples from all over the region because we can just pop our samples into FedEx bag. So we have very large economies of scale that we can bring in. So our costs are typically about a third of the price that they would pay going to the clinic. But what's tied to cost and what is the kind of the first bit of accessibility for us is that a lot of women, our first products are geared for women's health. They wouldn't even be able to get these tests. They don't meet certain clinical criteria. So the inability to conceive for a year, or having certain PCOS, for example, symptoms that are quite acute. And even then, not every clinic is going to be able to offer AMH testing for you. You have to go to a fertility clinic or a specialist clinics, where of course the costs are even higher. So that's tied into costs, but it's also just making these available in the first place.
Of course, yeah. One of the barriers at a patient or consumer level of many of these type of let's call them lab tests to give it a generic name here, is the fact that when the information arrives at their level, it's complete gobbledygook in terms of the way in which the information is presented back can only really be understood by an HCP. What are your respective businesses doing to try and provide better understanding of the results by the patient or the consumer so that you remove another barrier of ownership in healthcare?
Oh, okay. I'd like to tell you about our business model. So after sequencing, we provide the solution through the genetic counselor or physicians who have the knowledge on the genomics and the health. So with all the genetic sequence, and now we can tell what's the high risk. For example, PCOS if you have found the CYP11A gene or the CYP21 gene, which is associated with progesterone and steroidogenesis, then we can tell which that person has a high risk for the PCOS. But then it's better to recommend like company like Yesmom to do the screening. Colon cancer is another good example. If you have a high risk for the colon cancer, we're gonna recommend do the colonoscopy starting much earlier than 50 years old and then more frequent, right? So what we are doing is that in order to remove the barrier, we are asking them to our physicians to make the personalized screening and preventive screening and consultation plan for the next 20 years, so that that person's entire genomic, entire health is mapped out. So you know what kind of relevant task to do, and then what to watch on. So that's our approach to reduce the barrier to the healthcare.
Which is applaudable, but are your results in any way easily consumed by the patient, or do you always need the interface of the counselor?
This one, our task is more for the genetic counselor and physicians, okay. And then they have access to the all the for the rare diseases. Still, they are not that used to it. So there are 7,000 rare diseases. So we have a description in our digital twin so that they can get the idea remind themselves. But what patients or what customers gonna get is the screening plan that it's a action roadmap so that they know what to do in the future. So it's gonna be very simple to follow. Yeah.
Okay, thanks, Sajung. Peter?
Yeah, and I think for us, I mean, that is our core product, really. This is what we develop. It's a lab report is hard to decipher. Even someone in the medical space, when I get my lab results, I'm still spending a lot of time on Google trying to figure out what it means. That's after having spent time with a doctor. What we have designed is to make it as much as possible that the healthcare consumer has enough information in their hands that they don't need to go anywhere else. They might not necessarily even need to speak to a doctor at that point. So we generate, obviously we provide them with the lab results for them to try to decipher or take to their the regular doctor. But then we create reports automatically on what their levels actually mean for them. So in the case of fertility, we generate about six to eight reports that are really specific to use cases. So we look at ovarian reserve, menopause timeline, PCOS. We look at thyroid function. So what these different levels of hormones combined with their age and a few other medical questions they'll provide. What does that actually mean? And there's different layers of it, obviously, of how much they want to learn. So it gives them the high level view. Okay, a high level of testosterone, it's marginal, so it might not mean anything. This is the implications for your health, and then you can dive in much deeper. And if you really want to be an expert, you can keep reading and get the deep dive on it. So that by the time they're done with that, they have all the information they want. And any kind of follow-up with a provider can be much more meaningful because at that point they're not just asking the basics of what this means, but what they can actually do about it. And we want to make all this information actionable.
Fantastic! I look forward to seeing an example of the consumer end of your product, Peter. We're unfortunately running out of time, and so I'm going to keep an eye on the core focus of your day-to-day work, which is scaling your business. Much of our audience is for this cohort is corporations, all looking for the right partner in a specific area of digital health. And so I guess my last question to you is, as you think of the audience, which is going to be primarily pharmaceutical companies, medical device companies, insurers, as well as many others, what would be your request of them, and what you're looking for in those industries by way of partners, and what you want from them? And let me start with you, Sajung.
Yeah, I think at first I want to talk about the preventive health first, because we are in the space of preventive health, and then let me address that question. So the basic idea is that preventive health is just like the putting the screen door to keep the bugs out of your home. So that's in order to prevent bug coming into your home. Then currently, all the companies are focusing on a couple of diseases, couple of hundred diseases they could excel. But for the preventive purpose, when you put on the screening door, you have to put it entire window. Otherwise, if you put 10% of the window, 20% of the window for the screen door, doesn't matter. The bug's gonna keep coming anyway. So that's the niche we are addressing. We are putting the screening door for the entire window. And then for the corporate partners, we are looking for the corporate partner to provide this preventive solution to the entire audiences that whoever needs. Of course, currently healthcare is focused on the acute care, but what I'm proposing is that we need to shift the focus into the proactive preventive care. So if you are interested in shifting your focus on the proactive preventive care, probably Predictiv could be one of the good possible candidates to partner with. Yeah, thank you.
Great, thank you, Sajung. Peter, what's your need?
Very similar to what Sajung said. We're looking at screening in the context of kind of employee wellness, being able to screen particularly populations where the context of the work, certain health conditions could impact their safety. So looking at working with insurance or other kind of providers, looking at population health screening of your for risks in your employee population. The other is with any kind of diagnostics company. We're always looking for new tests to bring to market, whether it is within a lab setting or even more and more using kind of lateral flow or instant test results. Always trying to develop these new things and commercialize them. So we're always keen to speak with diagnostic companies about that. In terms of pharmaceuticals, we have a lot of data. We're able to do with this technology a lot of kind of remote sampling, which could help in kind of clinical trials, for example, as well.
Great, thank you very much for your candid answers, gentlemen. It's been fascinating to hear how you're coming at it slightly different angles, but of course, really, I think contributing significantly to the democratization of healthcare as we see digital health playing a major role. It would have been great to have had the chance to talk to you guys around how do you see the field progressing, how do you see it looking in a few years' time, but unfortunately, we run out of time, so that'll be for another panel. So thank you, and we will, of course, be no doubt fielding a bunch of questions from people watching this panel, which we'll share with you, and you'll have an opportunity to address those questions as they come in. But thank you very much for your time, and the very best with the scaling of your ventures. It's been a pleasure.
Yeah, thank you very much.
Thank you very much. My pleasure.
Yeah, pleasure. Bye.